Medicine.
You're doing great.
Okay, welcome to the Deuk Spine Institute and our live stream of spine surgery. Our first patient today on May 25th is a gentleman who, like many people, has suffered with lower back pain. I talked to him in pre-op for 40 plus years. He said maybe even 50. Lay still. All right. Is that his leg squeezer or he's just moving his legs?
Leg squeezer.
That's him moving his legs. Just lay still, you're fine.
Move your legs.
All right. So 50 years of lower back pain. Can you see all this, Henry? Lower back pain, 50 years, right?
We can see it.
When I asked him, where is your back pain, he showed me it's all in here. So I looked at his MRI and I saw that he's got some problems with his discs at 3-4 and 4-5. That's probably causing that pain. All right, so we have the L3-4 disc and we have the L4-5 disc. Pardon my writing. And I saw that he had a herniation at L4-5, which was, by the way, recurrent. So he's already had back surgery years ago by another doctor, not me, and he has had microdiscectomy. Sean? So I don't do microdiscectomies anymore because they're too destructive to the spine. People ask me, what's the difference between Deuk laser disc repair and microdiscectomy? The answer is microdiscectomy is horribly destructive. The surgeon makes not just a bigger incision, but rips your muscle off your spine. Are you comfy?
He said yes.
All right. So,
He has a hearing aid, so we kept it in.
yeah, I saw that in the pre-op. Sean? Sean? Perfect. All right. Whew. He's hilting it. Sink into the hilt. All right, a little bit of numbing medicine. I apologize.
A little needle stick. You're doing great, my friend. You're doing
Okay.
great.
So
That's
this
all just numbing
50
medicine.
years of back pain.
We're gonna
And
get you better, okay? Just
he
move
had a
your hands. Don't move your
microdiscectomy
hands.
done.
Don't move your head.
Anybody know when the microdiscectomy was done? That was a while ago, right?
It was 2012.
2012. So about 11 years ago, he had the microdiscectomy where they took out his lamina, part of his facets. You could see it on the MRI. He's got scar tissue everywhere down there from that procedure. Horribly invasive procedure. So, but he's never been out of back pain, and that's because microdiscectomies don't treat back pain. We all know that. How's blood pressure? Good?
Yeah.
All right, so I'm trying to get to 4-5.
Slow deep breath, buddy. You're doing great.
By the way, the surgery you're watching, the Deuk laser disc repair, it's state of the art. It cures back pain that comes from a disc problem, okay? A herniated disc, bulging disc, ruptured disc, protruded disc, extruded disc, degenerative disc, prolapse disc, any of those disc descriptors. Oh, good. We're awfully close. You're doing great. Just lay there, lay still. And Henry, would you be kind enough to show our audience, Sean, how does a disc problem actually cause back pain?
Traumatic injury to the disc can cause annular tears to form. Pressure on the disc causes herniation of the nucleus pulpus through the annular tear. Inflammatory tissues develop within the annular tear, causing back pain. The inflamed annular tear generates pain signals. Additional injuries can cause symptoms to worsen. Inflammation from the annular tear can spread to nearby nerve roots, causing leg pain. Signals travel up nerves to the brain, causing localized back pain. Pain signals reach the primary somatosensory cortex, causing conscious awareness of pain. If you have a herniated or bulging disc and back pain, submit your MRI for a free review at www.mri.deukspine.com.
Reliable? Okay, welcome back. You can see from the x-ray that we are looking at the front of the spine, and then now we're going to go to the side. And at this point, what we're doing is placing needles into the spine. These needles are going to guide the rest of the surgery. Shot? That's better. Right there. Shot? I like that. All right. Sorry about that. He's a little sensitive. Yeah. Any pain down your leg?
Are you having pain down your leg or in your back? Where? Where? Left? He's having pain right at the shot where you put the...
Yeah. All right. Perfect.
Thank you, my friend.
So far so good. No pain down the leg. We're well below the nerve root. Jordan, show our audience where the nerve root is. Take a better picture than that, please. That's a blurry one. There you go. The nerve root comes out underneath the pedicle. See that little triangle right there? Show them the triangle. Yeah, there you go. So show us the pedicle of L4. That's the pedicle there. Where's the top of the pedicle? Pedicle's a bone, by the way. It's a finger-like bone there. And then show us the bottom. That's what we put screws in. Now, if this patient wasn't having Deuk laser disc repair, he'd be getting a screw in that bone right there. And just below the pedicle is where the nerve is. So we want to steer clear of that. And we're looking good. Shot? So we're in the L4-5. Now, today we're going to fix L3-4 disc. Show us L3. Henry, can you see the arrow? That's the L3 vertebral body.
Yes, we can.
Show us the L4. That's L4. Show us L5. And you can see the disc between L4-5 and L3-4. And you can see that we've accessed those discs. And it looks like we're going straight through the back, right? But we're not, because straight through the back, which is what every other spine surgeon does, there's bone there, and you can't get through it. You got to drill it away, which is why we don't do microdiscectomies. Let's get an AP. We're going to show you we're not actually going straight through the back. We're coming from the side. It just looks like on a side view x-ray we are, but we're not. All right, good news is, shot, there it is, right there. Show us the tip of the needles, one at L3-4, one at L4-5, perfect. See how the needles are coming from the side, guys and gals, from the right side, there it is. Then show us where the needles come together right there. Yep, that's where the skin incision is, right? That's where they're both going in at the same place. So they start there together, but they don't end there. They don't end in the same place, they end in different places. And that's why we're able to treat multiple disc herniations with one incision. Take a look at the incision. It's just 7 millimeters. Let's get a ruler. You guys see this? Metric ruler, okay? And the incision is literally, well, all right, so it's probably 8 millimeters today. 8 millimeters, that's nothing. His incision for his microdiscectomy, you can't really see it through the drapes, but it's this long from here to here. So it's this long, okay? And through that microdiscectomy incision, he's got scar tissue, he's got dead muscle down there, he's got the bone is removed from his spine, and ligaments are removed, and the facet joint's damaged. All right, is he reliable?
Yes.
Are you comfy?
He said yes, he is.
All right, good. See that? He tightened up. How bad is that on a scale of 1 to 10?
Give us a number. Says a number. What?
10? He said 10.
9.
Oh, 9. Okay. I thought I heard 10.
Thank you.
All right. So is that where you get your back pain?
Yes.
All right. Good news. We're going to fix that for you. So 9 out of 10 pain when I
job,
just
my friend.
put a little pressure on it.
Almost done here. We're going to sleep.
The C stands for concordant. Not yet. That was L4-5. Okay, and show us the annular tear, Jordan. This is where his pain comes from. We discovered this at Deuk Spine Institute, right where you're watching the surgery. This is the birthplace of this information. It is the tear in the back of the disc, right where Jordan is pointing, that little tear. We're going to go clean it up and his back pain will go away. All right, you comfortable? You comfy?
Yeah, he's comfortable.
I have to speak loud because he's got a hearing aid. Oh yeah, you see him tighten up there?
Give us a number.
Show us the tear, Jordan. What's the highest it went? What's the highest it went?
10.
10. All right, so 10 out of 10 at L3-4. Now, is that where you get your pain typically?
Yes.
Yes, so concordant. All right, we can put him to sleepy land.
We're going to go nice and slow.
And when he wakes up, you take your time, Dr. Berndes. You be safe. So show us the lateral view, please. And Jordan, show us the tears. Henry, can you see the tear at 3-4? It's much bigger. Actually, it's not bigger. It's just taller. Show us tall. Tall is top to bottom, up, down, versus the one below, which is shorter. And the reason why it's shorter is because the bottom one is older and more collapsed. But they're both painful. And Henry, let's show the audience how this surgery actually works to cure back pain in patients with back pain.
Disc herniations are a common cause of chronic back pain. The inflamed annular tear causes back pain. Inflammation of the nerve roots causes leg pain. A Band-Aid-sized skin incision is made. A small tube is inserted without damaging the bone or soft tissues. The laser removes the herniation and debrides the annular tear. The annular tear heals on its own. If you have a herniated or bulging disc and back pain, submit your MRI for a free review at www.mri.deukspine.com.
Welcome back, and now you can see how the Deuk laser disc repair works. The Deuk laser disc repair is a proprietary treatment where we go endoscopically into the spine. We go through a tiny hole that's on the side of the spine called the neuroforamen. That hole is naturally there, it's always there. And a doctor named Parviz Kambin, P-A-R-V-I-Z, Kambin, K-A-M-B-I-N. He was an orthopedic surgeon in the 90s. Dr. Kambin was brilliant, and he figured out, while all the other spine surgeons were coming to the spine in the middle and having to remove all the bones and ligaments to get down to the disc and the nerve root, Dr. Kambin said, hey, why don't we come to the spine from the side? He was an Iranian doctor. He was an Iranian surgeon. And he basically paved the way to do what's called transforaminal surgery. Now, he did have a doctor before him, Dr. Wiltse, and Dr. Wiltse had an idea of going through the foramen as well, but not endoscopically. So Dr. Wiltse was the first to do transforaminal surgery, I think, and then Dr. Kambin was the first to do endoscopic transforaminal. Let me know when I can proceed. We're just trying to get the patient comfortable. I would just keep him light.
That's what we're going to do.
Let him breathe on his own. Yeah. He may be a little uncomfortable, but that's, it's fine. Yeah, it's fine. Let me know when I can proceed. All right, so we're going to advance the dilator into the disc. It may stimulate him a little bit, which not a bad thing to get him to breathe. Shot. I know we have questions, and I'll take them in a moment, but let me just get this through the tear. Somebody asked me the other day about the YES procedure from Dr. Young, Y-E-U-N-G, Tony Young, Dr. Young. And yes, I did learn the YES procedure from Dr. Young. YES stands for Young Endoscopic Spinal Surgery, and I was taught by Dr. Young. I was one of his students. So he learned from Dr. Cambin. Remember I told you Dr. Cambin was the first to do transforaminal endoscopic surgery? Well, Dr. Young learned his technique from Dr. Cambin. Then he went to Arizona, and that's where I learned from him. But I learned prior to him how to do it from Dr. Royton and other surgeons that were doing endoscopic. The Koreans over in South Korea, Dr. Sang-Ho Lee, Dr. Gun Choi, they were true pioneers in cervical. How's he doing?
Okay.
Yeah, I mean, he's not moving around. We're fine. Let's just keep him awake. And
Really bad.
yeah, so our patient is has a lot of medical conditions, and normally surgeons wouldn't operate on patients with a lot of medical conditions, but he's in so much pain and nobody else was going to be able to help him, so we decided we're going to help him and try to get him out of pain, give him some quality of life. After all, lower back pain for 50 years, that's restricted his life. I mean, think about it. Being in pain that long, not able to do things that everybody else is doing, activities, because it makes the pain worse. So he's been really deprived of quality of life. And we want to give him some of that quality back to his life. So we decided, even though he's in bad shape medically, that as long as he was willing to take the risks of having a complication, that we would do the surgery, for him. There's the tear that he's had for 50 years, right there. And that's what's been hurting him. Are we okay?
Just checking.
Yep. So the fact is that when you are really healthy, you can have a deeper anesthesia. When you're not as healthy, you have to have lighter anesthesia. These cases are all done outpatient. These patients are getting propofol sedation with MAC, and we have to monitor their CO2. It's called the end-tidal CO2. Make sure they're ventilating. You can hear him kind of snoring a little bit. He's got some secretions too. Can't give you too much of the history, but he's got restrictive airway disease, so he's a bit of a nightmare to manage from an anesthesia standpoint. From a Deuk laser disc repair, on my part, it's pretty straightforward. You can see herniated disc here, scar tissue. You doing all right, Dr. Berndes? Yeah, just keep him light. He's not.
Look at the monitor. See how it's doing.
Huh?
Look at the monitor.
Me?
Yeah, I'm telling you, do my best.
Don't give me an answer. Look at the monitor. I'm asking you. All right, let's take the question, Henry.
This first one comes from Elaine on Facebook, and they ask, can the Deuk laser disc repair be used to treat spondylolisthesis?
Can the Deuk laser disc repair be used to treat spondylolisthesis?
Correct.
Great question. So for those of you who don't know, spondylolisthesis is a slippage of one bone on another in the spine. And spondylolisthesis does not need treatment at all, ever. What needs treatment is pain, back pain, and leg pain, or radiculopathy. So for many years, doctors have been telling patients they have spondylolisthesis, they need surgery, like a fusion, for example. And that's what doctors are telling patients today. 99% of spine surgeons will tell their patients they need fusion done for spondylolisthesis, but it's not true. It's basically a lie. It's misinformation. We have treated spondylolisthesis in hundreds and hundreds and hundreds of patients with the laser, and we're not fusing them. We're not even treating the spondylolisthesis. We're treating the tear in the back of the disc, just like you're seeing right now. As a matter of fact, this patient has spondylolisthesis, right where we're operating, at L4-5, okay? And we're not gonna fix his spondylolisthesis at all, but we are gonna get rid of his back pain. So what people need to understand is spondylolisthesis doesn't need treatment. Scoliosis doesn't need treatment. Kyphosis usually doesn't need treatment. What needs treatment is the symptoms, and the symptoms are not coming from the spondylolisthesis. They're actually coming from the tear, as Deuk Spine Institute has been saying for many years.
Our next question comes from Canes25 on YouTube.
Hello, Canes25. Welcome again. I'm starting to wonder if you go to work, Canes25.
And they asked,
I say that tongue in cheek.
can you do the lumbar and thoracic at the same time?
Can we do lumbar and thoracic at the same time? Yes, we can, as long as it's not too many discs that we're fixing. So our limit is 6 spots, 6 areas, and just to give you an idea, if somebody has a herniated disc at L4-5 on both sides of their spine, left and right, and they have leg symptoms on both sides or leg findings on both sides, weakness, numbness, then we have to do both sides. And that's 2 spots. Even though it's 1 disc, it's 2 areas of treatment. So we can do a total of 6 areas of treatment, okay? And the reason is that by the time you're doing 6, you're pushing up against a 2-hour kind of limit of what we want to be safely for the patient. Okay, there's a herniation right there, by the way. And that's a fresher one. So this herniation, this patient's back pain has been 50 years. His annular tear is 50 years old, but his herniations are not 50 years old. The herniations are different ages. Some of them are older, some of them are younger. In my opinion, the average patient like this that has a tear and herniation, they have about 30 to 40 herniation events in their lifetime. So that means they've herniated 40 times, 30 to 40 times. And that happens over 40, 50 years. Maybe 10 events per year on average, maybe. I'm just saying, kind of guessing right now. But I would say if I had to make a guess, an educated guess based on my experience, I would say the average patient probably has 5 to 10 herniations a year from their tear, from their torn disc. And every time they herniate, you can actually see a new herniation. And then over time, that herniation gets scarred, inflamed and scarred, and degenerated. It turns blue with the stain. And then we get the scar tissue, this white stuff here. You get calcification of the scar tissue. All right, so calcium deposits. So we understand what happens inside the disc, what causes degenerative disc disease. Deuk Spine has discovered it. It is inflammation of the disc from an annular tear with a herniation. And by the way, we're getting ready to launch our new website. Unfortunately, I had to fire the person that was doing it. And we're going to have to hire a new company to start over. So we've been talking about our website for a while, but unfortunately there's a lot of scammers out there that'll take your money and not give you what they're supposed to give you. And that unfortunately happened to me with our website. So the good news is I have a crystal clear vision in my mind what the new website's going to look like, and that doesn't change. And by the way, I was the one doing all the content generation because I'm the one who understands the subject material. So the new website is going to be something that people have never seen before. It is going to be absolutely unbelievable. And in its final form, which we will not have the final form right away, in its final form, it may actually be my greatest creation. It's going to be unbelievable. I'll just give you a hint. There's going to be a lot of animations to explain how herniated discs and annular tears cause pain, facet joints, how they cause pain, how we treat them. I anticipate 50 to 60 animation videos that are state-of-the-art, high-tech, detailed, highly informative. And the reason we're going with animations, folks, is number one, text is boring. And nobody likes reading text, right? Not even me. Number two, a picture paints 1,000 words. We all know that. So a video animation, which typically is 300 pictures, the short animations we have, they're about 30 seconds. These animations for 30 seconds have about 300 pictures, and they are all literally edited by me individually, precisely, every second. The timing, the content, everything I've sat there and had to personally review. Now, the actual design was done by a programmer in Sweden who I'm working with, who's amazing. And I'm so happy I got turned on to this guy. But he's helping me create these beautiful animations. We've got, I think, actually, you know what, Henry? We've got about 6 of them done. You know what would be nice is I would like to load it so that we can show our audience. We've got some of the lumbar stuff done. So you know what? Maybe I'll figure out how we can show it during surgery. That would be really cool with one of the lumbar ones.
Copy that.
I didn't even think about it till just now. So we'll work on that. All right, what other questions do we have from the audience at this time?
No current questions, but we do have 2 comments. The first comment comes from Canes25 once more on YouTube, saying, I do work full-time. I'm just fortunate enough to catch you, sir. Love it.
I know, man. I'm just joking with you. You know that. Laser, I hope you don't take offense. Sometimes when I get bored and I get comfortable with certain people, I start cracking jokes. But it wasn't meant in a bad way. I'm very happy you're here. We love having our audience here to learn and support what we're doing. So there at 12 o'clock is some fat. Remember, we're looking towards the thecal sac, towards the nerves, and you can see some fat, you see some veins, but that's the outside of the disc. We're looking at the back of the disc. We are outside the disc, and I want you to notice that the inside of this tube, okay, the inside of this tube is about 5 millimeters, right? And the laser fiber you're seeing right there is 1 millimeter. So if we count 1, 2, 3, the hole where we just got rid of the herniation is around 3 to 3.5 millimeters wide. So people ask me, how long does it take for that to close up? The answer is it takes about 9 months to a year. Why? Simply because the disc doesn't have much blood supply at all. And, you know, it's just the way God designed it. And things that don't have much blood supply, well, they heal slow, very slowly. So I can't speed that up yet. I have some ideas, but I'm not going to discuss them just yet. But eventually, and I've looked at all the stuff on the market, by the way, in case you're wondering. What about disc seal? What about barricade? What about all these things? They don't work, folks, and they only create more problems for patients. So I don't do things that don't work. I stopped doing things that don't work when I started to treat my own patients, okay? And fortunately, I trained at a very good neurosurgery training program. My attendings that taught me, they didn't do surgery that doesn't work, ever. We were very careful, meticulously planning our surgeries for patients to make sure they were the right surgery, the best surgery. So I was trained at the University of Florida in Gainesville by Dr. Albert Roten. He was the chairman at the time that I was there. And he held the philosophy of the entire department, which was always do what's best for the patient. And so he had the best neurosurgeons from around the world, around the country. And their philosophy was to always do the best surgery you could do for the patient to fix their surgical problem. And that's what I've learned to do. So fortunately, I've never had to do procedures that don't work. That said, a lot of doctors today, a lot of doctors today that treat back and neck pain, they do procedures that don't work, that don't cure the pain. So you may ask yourself, why am I doing these pain procedures? Because I'm not doing what they're doing. I don't do procedures that don't work. They do procedures that don't work, but we do procedures that actually eliminate pain, permanently cure it. And that's the Deuk laser disc repair and the Deuk plasma rhizotomy, 2 procedures. And if you know how to do these 2 procedures, you can literally cure 95% of back pain and about 99% of neck pain and 99% of thoracic pain. Sorry about that, my friend, but we need you to be a little more awake today so that you can stay alive. All right, this will be our second and last disc that we're fixing. This is the L3-4. He rated this, what, a 10 out of 10, guys? Right? And 4.5 was a 9 out of 10. Is he doing all right? Yes. Thanks. Okay. So we finished one disc repair at L4-5. That was the one that he had the reherniation at because he had a microdiscectomy many years ago, and then he reherniated at L4-5. And by the way, why did he reherniate? So Kane's 25 probably knows the answer to this.
I'm sorry. Yeah.
Okay, I'll show you why. Anybody watching? So the annulus is normally a wall that holds the jelly in. And people get a herniated disc because they get a tear in the wall. And then what happens is, after time and basically activities, that tear in the wall gets filled in with the only thing that can fill in is the nucleus, the stuff from the center of the disc. It gets pushed out, and that's the herniation. With a microdiscectomy, the surgeon does not clean that out. They take what they can with the grabbers, okay? They take what they can with the grabbers. They grab and pull and grab and pull, but when they're done, after a microdiscectomy, that annular tear, the annular tear is still there, and it will never heal. What I do with the laser is we basically use a laser to cut all this junk out, and we allow, now you guys saw it, right? The annular tear was 3 millimeters wide, and that is going to heal over the next 9 to 12 months. The Deuk laser disc repair, what we do at Deuk Spine, is the only surgery in the world that does this. We are the first to publish it and the first to do it. And we've been doing it now 16 years with basically 100% cure rate for discs that are painful. Oh, wow, look at all that inflammatory tissue right there, Henry. Pretty cool, huh? The pink stuff? That's what we're talking about, inflammation inside the tear. That's what we're here to treat. And this is L3-4. So I'm going to grab out any loose pieces of herniation I can. There's not much. And I'm going to start my annular debridement. And the annular debridement has to be done with a laser. There's nothing else that works. People say, why do you need to do laser spine surgery? This is why, right here. 98% of what we do in the surgery is the laser. Somebody is going to have to go back someday and watch all my videos and then add up the time that we doing laser versus grabbers, and they'll show that, you know, probably 95 to 98% of the time is laser, and the other, 2 to 5% is grabber. So I need research fellows. I have so much data to mine and publish here at Deuk Spine from all these years of doing surgery. If anybody out there is a doctor interested in learning, you're going to have to come here for at least a year, possibly 2 years, but we'll get some papers published. There's too much to publish. I can't handle it all on my own. I'm doing too much already. Building this new website and the AI database and all these patents I'm working on and development and taking care of patients and running a company. It's too much for one person. So I could use some good people to help us. achieve some of these goals. All right, questions?
We have a question from Matt on YouTube.
Hey, Matt, how are you?
They asked.
Hey, there's a piece of herniation right there. You guys see that?
Yes, we
That's
do.
what a herniation looks like. It's a little blue because we stained it blue, but that's because it's staining blue because it's degenerated. All right, sorry, Henry.
Question from Matt asks, what does the recovery and timeline look like for someone who undergoes the DLDR? Does it vary from patient to patient?
Yeah, great question, Matt. First of all, you guys see this? There's the tear right there. You see the blue stuff is sitting in the tear. There's the left side of the tear. There's the right side of the tear. And look at the blue. That's all nucleus pulposus, herniation, stuck in the tear. That's where all the inflammation and pain comes from. All right, so recovery for Deuk laser disc repair is literally 1 hour. It's outpatient. We don't go to the hospital. We do it outpatient in our surgery center at Deuk Spine. It's called Surgery Center Viera, located here in Florida. So you come in, you spend about an hour before surgery getting your IV in, doing paperwork, and then you do your surgery for an hour, and then you recover for an hour, and then you go home. A lot of our patients travel from other countries, other states, so they stay in a hotel overnight, and then they come see me in the morning, and we just do a quick check, make sure everything looks good, and change their bandage if we need to, answer questions, make sure they're doing their, go over the exercises they need to do, the walking, and the limitations of activities, and then we answer questions, and we give them a big hug and maybe do a testimonial if we have time, and then we send them on their way, and that's it. So you can go back to work literally the next day if you want to. Now, we've had people go back to work the same day. Okay, we had a basketball coach for a national championship basketball team, high school team, and he wanted his surgery done before he did his championship game. And then he did his championship game the same day. He coached it. All right, so he didn't drive, of course, but he coached it. And we even have a video of that, testimonial of that online. So you can actually do some work the same day. That's how good the anesthesia is for this, and how wonderful the surgery is. You don't need narcotic painkillers after surgery. We don't give narcotics. It's not necessary. Every other spine surgery, the doctor is going to give you Percocets or oxycodones, and those are all highly addicting and dangerous drugs. But with Deuk laser disc repair, since we're not doing any trauma to the inside of your body, you don't need painkillers. You just take a Tylenol, that's it. Most patients take one Tylenol at night, and then they're done. There's no more medicine at all, just a Tylenol, over-the-counter Tylenol. Tylenol is acetaminophen. You can find it in every CVS. It's on the shelf. You just go grab it. All right, there's the tear. So we're working our way from the inside of the tear to the outside of the tear. And pretty soon we're going to be on the outside of the disc. There's some calcium right there. You guys see that? That's a calcified piece of calcified herniation. It's scarred up as well. That's why it's so flat and white. It's all scar tissue. The blue stuff you're seeing is the nucleus pulposus degenerated and herniated. And the reason it's blue is from inflammation. If you take a piece of nucleus pulposus from the center of your disc, the jelly, and they put it in inflammation, it'll get degenerated, and it'll become acidic, ACIDIC, and then it'll stain blue. So the blue stain stains only degenerated nucleus. That's why we use it. It helps us find the herniations and the tears. Thank you so much. I appreciate you letting me know. Great questions from our audience. Almost done. Berndes, I got 5 minutes. We're done. Maybe less than 5 minutes. About 5 minutes. Huh?
Thanks for telling me.
Yeah. Questions, Henry? How many questions you got?
No current questions.
Oh. Good. That's all scar tissue right there. You guys see that white stuff? That's not normal. That's from chronic inflammation. That's from 50 years of inflammation inside his disc. 50 years of pain and suffering. Oh, by the way, I had a little Facebook discussion. Somebody did an MRI review with us, and they were upset because they have to pay some money up front. And he was all over the social media trying to make us look bad, which, by the way, I don't know. Somebody should tell them everybody has to pay money before they have surgery. It's called your out-of-pocket expense. So we'll talk about insurance for a minute. Insurance companies always require patients to pay some money unless you have a really, really good insurance where they won't require you to pay anything. Now, I'm going to tell you a story. My father was a doctor, OB-GYN, he's kind of an OB surgeon. And back in the 80s, literally late 70s, early 80s, like I was probably 7, 8, 9 years old, I used to go to his office every day after school and do homework, wait for him to be finished, and then go home with him. And my sister as well, Tanya. So we would sit there, and sometimes you get bored, so you start asking questions. And I started nosing around, and I was watching how patients came in the door. I still see it in my mind. I could see the door. I could see the outside of that building in California. This was in Westlake, California, off Moore Park Road. I can still see the brown building. I can see the door. They would come in to the small waiting room. They would walk up to the receptionist, and they would check in. And back then in the 70s, the way insurance worked, it was really good actually for everybody. The patient would write a check at the front door. It would be $130 or whatever for the office visit. Then they get a receipt from the receptionist, and they would take that receipt and send it to their insurance company, and their insurance would pay them back what they paid. That's how insurance used to work. Then it changed, and it got to be where the patient didn't pay much or nothing, and the doctors started to have to bill the insurance ourselves. Okay. Anyway, back then there was no co-pays, no deductibles. There was no such thing as a copay or deductible. And I remember when the first copay came out for some of the plans, some of the insurance plans, back in the late 70s in my dad's office, the patients would get angry because they were told they had to pay a $5 copay. $5. This is back in like 79, 80. Look at that inflammatory tissue, the pink stuff, right? That's what we're here to get. That's what's causing the back pain. Anyway, they were pissed. And my dad would have to go there, and there was a patient complaining. He'd have to talk to him. And I said, "What's going on?" And he said, "Well, they're just upset they had to pay some money." And I said, "Well, how much do they have to pay?" And he said, $5. And I said, "Oh." I said, "Okay, so why are they upset though?" And he says, "Because they didn't have to pay it last year. Now they have to pay it." And I said, "Oh, well, why do they have to pay it now?" And he said, "The insurance companies are making them pay $5. And I said, "All the patients?" He said, "No, just that certain plans." I said, "Oh, okay." So I kind of had my first experience with a copay back in the 70s in my dad's office. And at the time I was 9 years old, 10 years old. I didn't really understand it or care about it. But I sort of understood that the patient had to pay out of pocket, right? Some money, and that they weren't happy about it. I realized at that point that copays were designed to do something. It was to keep the patients out of the doctor's office. So that's why they created copays, because some patient, just to basically disincentivize the patient. There's a tear right there. So of course the $5 copay after some time spread to all the insurances and then became a $10 for the bad plans. So if you had bad insurance, you had to pay $10. If you had good insurance, you paid $5. Yeah, there were some $2.50 copays too. Anyway, long story short, over time I went off to college, then med school, came back, and the next thing I know, copays are $25. A few years later, they kept going up and up and up, and then they created deductibles, and then co-insurance. Basically, all of these things are just financial tools, strategies for the insurance companies to keep their money by making patients pay more out of their pocket, so then they don't want to have the surgery, number one, but also number two, if they do get the surgery, the insurance company doesn't pay much for it because the patient paid most of it. So, folks, wake up, It's not your doctors that are the problem collecting your money or the hospitals. It's the insurance companies. Because it's not like the insurance companies are running out of money. They're making record profits. So they're getting filthy rich while you guys are getting filthy poor. And the crazy thing is that a lot of people online don't get it. They think the doctors are the bad guys, because we're charging money. And I don't know if people know this, but by law, we must collect the copay. If we don't, then we actually pay financial penalties for it. Believe it or not, you can be sued by the insurance companies for not collecting copays and deductibles. So those doctors that they just waive the copay and deductible for you, they will make you pay it, they're actually committing a crime. It's not a felony, right? It's like it's against the law though, because you're supposed to collect it. Now if you do that for Medicare, it's a felony. So if you start waiving copays for Medicare patients, you are committing a felony. And they will literally throw your ass in jail for giving old people who don't have any money a break. Because the way Medicare thinks about it, it's an incentive to get the patient to go to your office. And that's what they say. They say that you incentivize them. And that's against the law. It's a felony. So doctors get caught out on this all the time because they don't understand the law. And they just write off things, for patients. Oh yeah, don't worry about that $50 copay. Come get your surgery. Well, then the next thing you know, they're getting sued by the insurance company or Medicare, and they're in trouble. So anyway, that's what happens when you guys don't ask questions. I start talking. But that said, we got about a minute, and we're done. We have really cleaned this sucker out. You can see there's just a little bit of herniation left right there. And I'm zapping it all away nicely with the laser. By the way, the grabbers can't do any of this. That's why we have to use a laser. So all those people who say, oh, lasers don't do anything, they're not necessary in spine surgery. You can see those types of articles out there in Google. Those doctors are lying to you. Absolutely, they have no clue what they're talking about. They just know they're losing business to surgeons like me that are doing better surgery. And that bothers them to no end. So rather than learn how to do the right surgery for their patients, they'd rather try to take away the right surgery for the patient and have the patients go and get fusions with them. And you guys should be upset about that. I wouldn't tolerate that. But most people don't understand what's happening. So I kind of laugh now at people who are upset with me because they have to pay out of pocket. That's not my fault you have to pay out of pocket. I'm sorry I created a cure to back pain. You need to go talk to your insurance company because the insurance companies don't want you to have this. If people know about this surgery, everyone's going to want it. The insurance companies' profits are going to go down, and they don't want their profits going down. They'd rather you guys live in pain than their profits go down. So it's really up to you guys to fight for what's yours, which is a cure. You guys have to fight for it. You have to demand it. And sometimes you have to pay for it in advance to get it. Once again, you can see the defect is smaller than the tube. It's probably, once I pull the tube out a little more, it'll close even more. You guys see that? Let's get a little bit there in the back. But there's just a little bit here left. But we're pretty much done. All right, and if you have questions, I want you to type them up. And I'm going to answer them for you face to face. All right? But it's pretty cool, the stuff you can see in here.
Lights on, please.
A lot of fat. You can actually see the facet joint usually too, which is right there. There's a capsule around it. But you can see how the defect is now about 3 millimeters. So that's people ask me about that. Is that thing going to close? Yes. It's not 7 millimeters. It's 3 millimeters. All right. Great job, everyone. Dr. Berndes, and particularly you, for doing an amazing job. All right, type your questions up. This is a live stream. We don't hide our surgeries. We don't hide anything. And by the way, for those of you who are veteran viewers, You know that when we have problems here with stuff, equipment, whatever, you see it happening. And you see how we solve it. And that's part of the learning. I want the doctors of tomorrow, the surgeons of tomorrow, the spine surgeons, the healers, I want you to see how Deuk Spine dealt with these problems. We don't have a lot, you know, but sometimes we have an issue, something gets stuck, or we have to use a vice grip to get it out or something like that, and I want you all to see that. It's important. It's part of your education and training. That's the thing about surgery, is that it's kind of easy to do surgery as long as it's going well, but then it's the complications that you want to avoid, but if you get one, you have to deal with it properly. All right. Type your questions up. In the meantime, let me show you this incision. Once more, you got a stitch? You guys see it right there? Henry?
Yes, we do.
So 8 millimeters, 8 millimeters. Luis, where's my stitch? Thank you. We like to put a single stitch, especially a patient who has aspirin on board. Those patients typically will ooze a bit, and that oozing seeps through the bandage, and honestly it's not that big of a deal, but it makes the patients upset. Then they're calling me at 2 in the morning and they don't know any better. It's not their fault, but shame on me. Why? We're gonna just put one stitch, and then Luis is gonna do a nice bandage. All right, type your questions up for me and I'll come answer them for you. Henry, you wanna? This is Dr. Aru Deuk-Majan, CEO and founder of the Deuk Spine Institute. I'm here with one of my patients, and you've traveled from where to the Deuk Spine?
Idaho.
Idaho, with your lovely husband, and we've had a few conversations. She came here to have her back fixed. How long have you had back pain for?
For over 7 years.
Okay. And what kind of work did you do before you retired, if you don't mind me asking?
It was desk work.
All right. And so you had back pain for 7 years. Did you have an injury to your back, or did it just kind of gradually come on?
It just gradually came on. I actually noticed it first in 2015 when I was gardening and I couldn't be up there for 8 hours. I was into it for about 4 hours and I had to take a break. And as time progressed, my breaks got longer and longer, and the amount of work I did in the garden was less and less.
Understood. And you're retired now. So what's it like having back pain limit your ability to do stuff when you're retired?
For me, it's very frustrating. I can't do that what I want to do. So we kept seeking solutions and nothing was working. They did work for a short while, but that short while decreased over time. It was shorter and shorter. My husband does research very, very well. Through his research, he found you. We read that you can fix my back, and you did fix my back.
That's right.
And I thank you.
You're welcome. So when did you have the Deuk laser disc repair done and the Deuk plasma rhizotomy?
I had those done yesterday in the afternoon. I am sitting straighter than I have. I'm standing straighter. I'm walking normal. It's like, wow, new me.
Look at that smile right there. I hadn't seen that until just now. So
well, it wasn't there yesterday.
Yeah, it wasn't there before surgery. And how long have you been not smiling because you've been in pain? I mean, really bad pain. How long has the really bad pain been there?
Well, the really bad pain has probably been over the last 5 years. It's something that was really tough to maintain a positive attitude and try to keep a smile on my face and keep Jeff's hopes up. I tend to be a positive person, but there were times when it does drag you down.
Of course, yeah. It's hard living with chronic pain, and especially with loved ones, they have a hard time, you know, relating. Of course, they want to be supportive, and your husband is a very supportive man, obviously. And he's a pleasure to meet. I know he's an author as well.
Yes.
And so what are you going to do now that you've had the surgery? And you could see actually the Deuk laser disc repair procedure she had done yesterday. You can see right here, we went into the discs that were damaged. You had 2 annular tears. We tested your discs during the surgery, and indeed they were causing your pain. So we verified that with our discogram. And then I went ahead and used the laser to clean up the tears that were causing your pain and get rid of that source of pain for you. And here you are, you're doing fantastic. How much of your back pain from before surgery do you still have?
Oh, virtually nothing.
It's gone.
It's gone.
Cured.
My lower back, I have not been without pain in my lower back until your surgery. It's constant, it's always there. I've never been without it. I'm without it now.
So are you going to go back to gardening?
You bet I am.
All right, very good. And what other things would you like to do now that you have a new back that doesn't hurt you anymore?
You know, the biggest thing I want to do? I want to go fly a kite.
Good for you. Let's go fly a kite then.
That's right.
Well, congratulations on having faith
Oh,
and being
thank
brave
you.
and getting it done.
Oh, not a problem.
Is there anything else you want to say to your fans out there?
I highly recommend Dr. Deuk's Spine Institute, Dr. Deuk personally, to help you fix your back.
Thank you. Appreciate that. All right. Safe travels.
Phew, that wasn't too bad, was it?
It was wonderful. And I'm Dr. R. Deuk here at the Deuk Spine Institute. I'm smiling because I'm sitting with my first surgical patient of 2023. I don't know if you realize that, but you were the first one of this year,
Okay.
of the new year. Now, you had the Deuk laser disc repair done on your lower back because you had 3 bad discs, and we did that yesterday.
Yesterday, yes.
And here you are, one day later. How do you feel?
And I feel good. I feel good, and the pain that I've been suffering for months is gone. I mean, I was a little bit sore, but that's from the surgery itself.
Yeah.
But otherwise, I feel good. Feel good.
Now, you've had back pain too, on and off for 30 years. We were talking about that. Tell us about those episodes of back pain. What do they do to you?
The first one that I recall was pulling out a sofa bed thing. And I got so far with it, you know, we had company and I was opening up the bed, and all of a sudden I just could not move. I couldn't move. My husband had to practically carry me. So I was out of work for a week or so, and then at the chiropractor, and then gradually it got better, and I thought, well, that's fine. And I moved on, and then, you know, had a couple other times like that. One time I was drying my hair, getting ready for work, with the blow dryer going like this with my hair, and all of a sudden, it's like I couldn't move. I couldn't move my arm down. I couldn't, I mean, it was that quick.
Yeah.
And just, I was out again for another week, laying in the bed and doing all that stuff. And then I thought I was fine, but I always, not always, but for many years now, probably at least those 30, I had lower back pain, where in the morning I couldn't bend over to brush my teeth. You know, that would really hurt.
Yes.
So I had that.
Do you have that pain now?
No, I don't think so.
It's gone.
The pain this morning, I was the first time in a long time I've gotten up first thing in the morning and was able to walk and not have that awful pain, because first thing in the mornings was the toughest.
I'm so happy for you. So how is this surgery going to
I'm
help you in your life?
Well, hopefully I can, once I can at least walk again. I was not able to barely walk with a walker. I was very active in my church and my
So you
community.
want to get active again?
And being in such pain now since July, and this is the new year, I'm anxious to get back to, you know, my life.
Yes, of course. Well, you had 3 herniated discs in your lower back, and you can see in the footage where we went into each of those 3 discs, and I used a laser to clean the tear where you had a tear in the back of each of those discs, called an annular tear, and the jelly from the center was stuck in the tear, holding it open, allowing more herniations to come out. So I got rid of the jelly that was in there using the laser, cleaned out the tear, and now your body will be able to heal that for the first time in 30 years. So I don't expect you to ever have that pain ever again.
Thank you.
You're welcome.
I am so thankful.
Well, you had faith
I
and
am.
you found us.
Yes, I
and
did.
You did what's right for your body, and I'm excited for you. So
I believe I did. I just kind of was led to you, and it just all went bing, bang, boom, and I didn't ask a whole lot of other people what they thought. I just did what I thought was I needed to do
good.
for me.
Is there anything you want to say to your fans out there?
I would recommend that if you do something to your back, that you take care of it early on. You take care of it right away. The longer you wait, the harder it is and the longer it takes.
It takes a toll on your life.
Oh, definitely. It has taken a toll on mine since this summer, for sure, where I have not been able to sometimes not function at all, barely be able to sit in a chair and be comfortable without squirming because I couldn't find that exact place where I didn't have pain. You know?
I don't see you squirming anymore.
No, I'm not squirming. I know. That's great. Sit here without pain.
Congratulations.
Thanks to you.
All right, have a blessed day.
Thank you. You do as well.
Good morning, I'm Dr. Deuk at the Deuk Spine Institute here in Melbourne, Florida, with one of my patients who traveled from California. He's been suffering with his lower back pain for years and found us on the internet and decided to come here and have the endoscopic Deuk laser disc repair. We performed that 12 hours ago, and here you are, ready to go back to California, it looks like. How do you feel?
I feel great. It took a long time to get to you. Surgery was quick and painless. I don't remember a thing. Your staff was wonderful, but I am pain-free.
That's awesome. Yeah, and you're going to stay pain-free. We don't have you on any pain meds. We don't have you on narcotics, killing your pain. We didn't put any medicine in your back to stop your pain, so what you have is natural. And do you feel that pain anymore that you had before you came here?
No, the pain is completely gone. In fact, I quit taking my own pain pills 2 or 3 days before I got here. And I am on no pain pills at all, and I feel wonderful. When I woke up this morning, it was a different day, and I feel great.
And I feel wonderful for you for doing that. That's why we do what we do. We can cure pain, and we want everyone to know that, because nobody should have to live with pain every day. How does pain affect your life every day?
Pain is traumatic. The kind of back pain that I was suffering put me in bed. And for the last 3 months, I have been absolutely useless. Absolutely useless. And so I found you. It took me a few months to get here, and it was worth the trip.
It will be for the rest of your life.
Absolutely.
Worth the trip. Pain robs us of our dignity, doesn't it?
It does. It absolutely does.
And your parents are here, and they're very supportive. And that, to me, is so important, that you have people that understand what you're going through. I'm sure your parents have been a big support for you.
Oh, absolutely. Yeah, I was at work, a short story. I was at work last Wednesday dealing with this pain, and my back finally gave out to where I literally could not walk anymore. And I was 600 miles from home. And so I called my mother and father. They flew to San Diego and arranged the trip to get here. I called your place. I was scheduled for February 2nd, and I asked Richard on the phone if he could get me in sooner, because I was desperate. And you guys got me in a week or two sooner, got me in the 24th, which was yesterday. And so we made the arrangements, and I flew here, stayed in the hotel for a couple days, and was operated on yesterday. And yeah, it's well worth the trip. I apologize for getting emotional, but it's been a long trip to get here.
Well, we want you to get emotional, because it is an emotional thing. When you've been burdened with this pain for so long, and then suddenly it's gone, and you realize that life can be lived without that pain, you know, and that you can actually have a life without the pain.
Yeah.
So what are you going to do now that you don't have the back pain anymore?
Well, I'm going to get my life back together. I've got a new job, and they've saved it for me. My boss is wonderful, and I'm going to go back to work tomorrow, actually, if you can believe that.
Yeah.
And I'm going to start riding my bicycle again and getting healthy again.
Well, your surgery went very well. I don't know if you've watched it yet, but we were able to get in with a tiny 7mm 1/4" incision and fix both painful discs, and they were both very painful for you. And the pain was coming from a small tear that's located in the back of your disc where your herniation came out of. And that tear was just so inflamed, and we were able to clean out the herniation that was stuck in your tear and use the laser to debride it. And that's what the Deuk laser disc repair is. It's a debridement of the annular tear to eliminate back pain and leg symptoms. So we also have a cyst. We didn't treat your cyst. And do you think the cyst is causing any problems for you?
At this point, no. I don't think so, because all of my symptoms are gone. This morning when I woke up, I was a little nervous about getting out of bed. But that subsided quickly when I stood up and could stand up completely erect with no pain or bindage feeling in my back.
Yes, when I walked in and saw him this morning for the first time, the first thing your mother said was, "Look how straight he's standing." So they must have watched you suffer for a long time.
Oh yeah. Yeah, my mom's a great lady. I'm blessed to have her in my life. And then that's my stepfather, Jerry. He's a wonderful man. He and I are pilots. We fly together. We do a lot of things. And he's seen me go downhill. He knew something was wrong, you know.
How did you find out about us?
I've been seeing a chiropractor in Sacramento for 35 years. And 2 months ago, I started to really feel bad. And I would go to him. And after about a month of going to him, and going to my doctor for some pain management for these symptoms, I finally figured out that something else was wrong with me. And so I asked the chiropractor, what can we do, because what you're doing is not helping me. My doctor put me on pain meds, and they took some of the sharp pain away, but nothing was helping. And so, being kind of a mechanical engineer,
Okay, sorry to cut that patient's experience short, but we have some questions and we want to get them answered. I just came out of the operating room, and surgery went very well for this patient. He presented more of a anesthesia challenge today rather than a technical surgical challenge. Anytime you're doing surgery with patients, there's always two considerations. The anesthesia side, which the anesthesiologist's job is to monitor the lungs, the heart, circulation, perfusion of tissues, the stability of the cardiopulmonary system, urine production, kidneys, etc. My job is to do the surgery, like cutting and sewing. Really, I've always said surgeons are like seamstresses. We cut and sew. That's pretty much what we do. That said, today's surgery so far went very well from a surgical standpoint. It wasn't that hard. He's a big guy, like obese, but the needle, if you watched it, it literally took the entire shaft of the needle all the way to the hilt. So, we were sort of at the limit there of what our standard equipment is. But we got it done. The real challenge was anesthesia, and honestly, he did great once we woke him up. He was not breathing well when he was too sleepy, so we kept him more awake, and he did fantastic. Thanks, Ron. Yeah, so for those of you who don't know how the surgery is done, this is the spine, the lumbar spine, and it's made up of bones stacked on top of each other called vertebrae. And there's really a front side of the spine and a back side of the spine. And the front side has the vertebral bodies and the discs. Can you see that okay, Henry? Yeah. Then there's the middle, which is the spinal column, the spinal canal right there. That's where the nerves are. And then in the back of the spine, you have the facet joints, which are there. You can see them. And then the bones here called spinous processes and lamina. That's this bone right there, okay? Spine is a little complicated, but basically it's a bunch of joints and bones alternating, and it allows flexibility. So it allows you to bend forward and backwards, forward, backward, and then allows you to bend side to side, and it allows you to do what's called rotation, where you twist a little bit side to side like this. So 3 different axes of freedom and movement, but each one is restricted differently. The spine, the lumbar spine in particular, moves very well in flexion and extension, flexion, extension, and it does decent in lateral bending, but rotation is terrible. Rotation is like twisting, right? Twisting this way. So kind of twisting like this, you know? And rotation is limited by the facet joints right there. They block the rotation because as you try to twist this bone on this bone, that bone hits that bone and it stops. So we only have about a couple of degrees, 1 or 2 degrees of rotation per segment in the lumbar spine. Long story short, this patient injured his lower back by doing some type of trauma 50 years ago, tore the discs at L3-4, L4-5 in the back, has herniations. He had a microdiscectomy done at L4-5 many years ago. The surgeon came through the back, hit this bone, peeled the muscle off the bone, pushed it to the side, ripped it up, then hit this bone, and then had to drill a hole in these bones, drill a hole in this facet joint, remove all that bone and ligament just to try to get down to the disc through that little gap right there. See how silly that is? But Parvis Camden and Wiltsey realized, hey, we can come from the side and get to the herniation through the side. Now we're not drilling bone, ligament, muscle. It's far less destructive, but to do it, you have to do it arthroscopically, endoscopically. So Dr. Camden took endoscopes that were designed for knees, shoulders, and orthopedics, and he applied it to the spine brilliantly. And that was back in the 80s, 90s. And here we are today with endoscopic spine surgery, and it's quite amazing, but it's not all done the same way. There's many different nuances and variations. So the Deuk laser disc repair is one type of endoscopic spine surgery. It's the best, and it's the best because I made it the best. Yes, I took the best from all the other surgeons and I basically combined it and then invented some stuff for myself that made it even better. Will you grab Arias, please? Thanks. Let's take our first question.
First question comes from Elaine on Facebook, and they ask, is turmeric a better anti-inflammatory for pain than acetaminophen or ibuprofen?
Is turmeric a better anti-inflammatory for pain than acetaminophen or diclofenac?
Acetaminophen or ibuprofen.
Acetaminophen or ibuprofen. Great question. So first of all, acetaminophen is Tylenol, and acetaminophen is not an anti-inflammatory, so that's an easy one. Tylenol or acetaminophen, same thing. Acetaminophen is an anti-pain, and it's an anti-pyretic, which is temperature, but it is not an anti-inflammatory. Ibuprofen is an anti-inflammatory, and turmeric supposedly is, but I don't know enough about turmeric. Arias. So I couldn't answer your question. It's a great question. I don't know the answer. Pizza. Okay.
Next question comes from Matt on YouTube, and they said, as far as lifting / bending, when can someone go back to 100% for those who have more physically demanding jobs when we can when we could turn fully to work?
So Matt, great question. I appreciate you answering. So as you can imagine, if you look at a disc, so let's just take the disc out, look at it. Here's the back of the disc right here. That's where the tear is, right there. And that's what we saw with the endoscope. Remember we saw a tear? You saw the left fibers, the right fibers, and you saw the jelly in the middle that was blue. I just used the laser to clean it out. When I was done, there's still a hole there that's 3 millimeters. It's going to take time for that to totally heal and get strong. It'll take 9 months to a year. So here's the deal. If you go back to full activities sooner than that, you'll probably be okay. But like anything in life, you're taking a risk. For example, if you're, if you decide you want to cross a street blindfolded, so you can't see, right? You can do it probably. If it's not that busy of a street, you might get away with it. But if you try to cross the highway blindfolded, the freeway, you're dead. So it's all about, probability, like how much you want to go back to normal activities. But if it's up to me, I tell everybody, listen, just give it a year. It's worth it. Let it heal properly. You'll never be back again for another surgery on that disc. It's fixed permanently with the laser surgery we do.
Lastly, we just have a comment from Elaine on Facebook, and they said, I don't mind paying for a surgical procedure that takes away pain, just try to live with it. Live it is with what it is. So hard to handle. You are amazing in my book. Actually, to find someone that wants to help a person keep up the amazing work.
Thank you, Elaine. I appreciate your sentiment and your comments. That's why we're here, folks. We're here because we want to get people out of pain permanently, not like other doctors. They want to keep you in pain, so they keep making money off you doing pain management procedures. We want to fix you and never see you again. That's really what we want to do. I'm sorry, but it's the truth. We're not interested in you keep coming back, billing your insurance, doing more procedures, more surgeries like everyone else. That is the wrong way to do it, okay? The wrong way to do it. First of all, every time the doctor does a procedure on you, you're going to be risking that procedure. The anesthesia risk, the infection risk, the damage risk. So we want to not expose patients to multiple procedures. We want one procedure and done. Second of all, we don't want you to keep forking out money out of your pocket, coming back every 6 months for more pain management treatments, epidurals, facet blocks, RFAs, spinal cord stimulators, more surgery, more shots. Every time you're coming to the doctor for pain management, you're forking out money. It adds up. We figured out that the average patient with chronic back pain spends $250,000 in their lifetime with dealing with their back pain. That's your out-of-pocket expense. That doesn't even include what the insurance company is spending paying for your treatment. So they may spend $500,000 on you. So think about saving 500 grand or 250 grand in your lifetime. You have better things to do with that money. Third of all, if you're getting pain relief that's temporary, that means it's coming back, the pain is. That means you're going to be incapacitated again, right? So it's interfering with work, interfering with your social life, interfering with your relationship with your spouse or kids. So we don't want you to keep having pain because we want you to move on and have a happy, healthy, productive life without pain. So the reason why you, the patient, want to get fixed right the first time, so you don't have to keep paying, so you don't have to keep missing work and missing out on life, and you don't have to keep undergoing the risk of surgery over and over and over again, through pain management procedures. So it just makes sense. Make the investment, get your back or neck fixed, never look back.
Lastly, another question from Darren on Facebook. They asked, what negative reviews have you received, if any?
What negative reviews have we received? We only get negative reviews about the insurance company and people having to pay money out of pocket. So what I tell everybody is, we know how to fix your back and neck. We don't know how to fix your insurance. That's honestly your problem. We can tell you how to fix it, but we can't do it for you. You're going to have to hold your insurance companies accountable. You got to make them pay. And we'll help you do that, but we can't do it for you. That's something the patient has to do because they're not going to listen to us. They don't care what we say. They care what you say. And if enough of you raise your voice, they'll hear you and they will change. So we are getting insurances to cover the surgery. However, it's not consistent. It's kind of like, well, I don't even know what I can make it associated to, but imagine you want something 100% of the time, but you're only getting it maybe 20% of the time. We're successful at getting insurance to pay for about 20% of our surgeries so far, but we're not giving up on the other 80. We're keeping them and we're fighting the insurance companies. I think eventually they're going to cover this because it only makes sense for them to cover it financially for them and for the patients. Great questions. Have a great day. We'll be back for a 3-level lumbar in about 30 minutes. Our patient's from California. She flew out here with 3 herniated discs in her back, leg pain on the left, and facet joint pain. Oh, by the way, she also has bilateral sacroiliac joint pain from these joints on both sides, undiagnosed, piriformis syndrome on both sides, torn muscle in her buttock, undiagnosed, bilateral trochanteric bursitis, and ischial tuberosity tendonitis, which is where the hamstring connects to your pelvis bone and it gets inflamed when you overstretch it. So she came here with, 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12 causes of back pain. And when I say back, I mean lower back and pelvic area. And now today, she has no more piriformis pain, no more sacroiliac joint pain, no more trochanteric bursa pain. All of her pain is her disc and facets, and we're about to fix that for her. So join us in about 30 minutes for our next surgery. You can come along on the adventure.